Welcome back. This is World Insight with me, Tian Wei. New COVID cases in Hong Kong have hit a record high, bringing the Special Administrative Region's 3-day total cases to over 100,000. Health experts from the mainland are working around the clock in Hong Kong to help with the Special Administrative Region. The central government has also been sending test kits and other supplies to Hong Kong. Hong Kong authorities are set to carry out a citywide mass testing. Hong Kong Chief Executive Carrie has urged residents not to panic after supermarkets have been emptied amid reports of compulsory testing and a general lockdown. Due to the COVID spike, the city has postponed the Hong Kong Chief Executive election until May the 8th. On all of these, here's my exclusive interview with Bernard Chan, convener and non-official member of the Executive Council of Hong Kong. He's also a deputy of the National People's Congress, or NPC. Its annual meeting is to convene later this week in Beijing. Hong Kong right now, Mr. Chen, is experiencing one of the most challenging period of time since COVID broke out in the world. Tell me more about the latest situation.
Hong Kong is experiencing our 5th wave of this pandemic, and you're absolutely correct. This is by far the hardest. Currently, we have something over 500-600 deaths since this 5th wave for the past 2 weeks, and obviously the death toll is far higher than all the deaths in the past 2 years. So this is by far have the biggest impact to us, and tens of thousands of people are being already tested positive. So this is a very serious situation, and the administration is trying its best to identify these positive cases so we can try to isolate them and treat them before any further spread of the virus.
Earlier, Hong Kong has been together with the mainland following a possible zero-tolerance policy toward COVID. But now, with a sudden outbreak of so many people testing positive, at least, how will Hong Kong adjust its approach?
What we're doing is we are making every effort to try to identify and cut further transmission. I think that is the main objective right now. Yes, we have tens of thousands of cases, and so it is difficult right now to do even contact tracing. We have been doing contact tracing for almost 2 years now, but I think due to this, this current surge of these tens of thousands of cases, it's impossible to do contact tracing. But doesn't mean that we are not trying to identify the source. We're still doing everything. As soon as we identify a particular building with more than a few cases, we lock down the building and we do testing to make sure that we can identify as much as we can these people with infection, so that we can isolate them and then we can treat them. And we're also now planning to have a compulsory testing. We call it compulsory mandatory testing, probably later this month, towards the end of this month, so that we would give us a chance to also identify as many potential cases that we don't even know right now, because probably a lot of these asymptomatic carrier in this community that we need to identify so that we can stop any further spreading of the virus.
Earlier, there were a lot of practices of putting people in hotels, in special facilities, and also there's support from the mainland on the makeshift hospitals. But with such a number, it is still possible. Is the approach likely to be more done at home? Tell me more about your thoughts.
Obviously, with this current surge of tens of thousands of cases, we no longer to adhere to the approach that we have been doing in the past 2 years. In the past 2 years, any positive case will be sent to the hospital for treatment. Now, clearly, we can't do that. I mean, I think when you were down to only less than teens in 20 and 30, yes, you can afford to send every single patient to the hospital. Today, absolutely not. Only those with serious illnesses, will be sent to the hospital for treatment. Most other cases, mild and symptomatic, currently they are mostly are now being isolated at home. Some of them will be sent to these isolation facility, quarantine facility, but those numbers are limited. I believe there's only less than 5,000-6,000 of them. There's no way that we can put every possible cases into these facilities. But with the help from the mainland, we are building these so-called CIT, community isolation facilities, in the coming weeks. But even that, we're talking about maybe 50,000, 60,000 of these isolation facilities. So clearly, it's still not enough for the tens of thousands of cases that we are likely to be found positive from the compulsory testing. So I still think that a great majority of those who are mild and asymptomatic, they need to be isolated at home. But because Hong Kong living condition is not good. Many people live in very small environment, 300-400 square foot apartments, or some are even living in these so-called subdivided homes, or some of these foreign domestic helpers. The employers do not want them to, if they are being tested positive, the employer do not want their employee to stay with them. So some are being pushed out of the home. So we still need these isolation facilities, public isolation facilities, to cater to those who cannot isolate at home. So I think the way forward is that home isolation is for those who live in conditions which is viable for you to isolate and mild symptoms, and for those who probably best to be put into a facility because they just can't isolate themselves at home, then we have these so-called CIT. And for those who are severely ill, they will be admitted to the hospital for treatment. So these are for those who are tested positive. In the past, we also have facilities to cater for those who are close contact to positive patients. But clearly, if we have shortage for even isolation, there is no facilities for close contact. So close contact currently are also staying home for ranging from 4 days to 14 days, depends how close they are to the positive patient.
The other thing is about to get the message out consistently and everybody speak in the same tone. Now that's very difficult, even for any administration, under such pressure of so many cases and evolving situation. Mr. Chan, tell me more about how Hong Kong is handling that issue.
Obviously, Hong Kong is an international city, and we have two sets of audience. We obviously have a local audience, the public Hong Kong people, and also that international community. And unfortunately, they want different things. I think the Hong Kong local public are very concerned of public health, and they are expecting the administrations to do everything they can to control the spread of the disease and to protect them, especially when we still have a sizable of our elders in Hong Kong are not being vaccinated. As a matter of fact, most of the deaths you're seeing now, you're hearing about it, are mostly from the unvaccinated elders. But at the same time, the international community, because of their cultural upbringing, as well as to some of their home country, those of them are already already quite relaxed about it, especially they are fully vaccinated. So they are quite unhappy and also quite concerned of these continuous restrictions towards them, especially if it requires them to travel. And right now, traveling in and out of Hong Kong is not convenient at all. We have heavy quarantine requirement for inbound returnees. And, for some of these international residents of Hong Kong, they are quite concerned of the coming testing because they worry that if they tested positive, would they be sent to these isolation facilities? And they are most concerned whether there'll be separations between their children and them, because if one of them are being tested positive and one is not, then they will be separated, and that's the fear that that most of them have, and some of them are choosing to leave temporarily, I hope, from Hong Kong. So we are quite frustrated because we have two set of audience. Not all of them, I guess, the correct message, and also I think there is somewhat of a biased commentary from the international press. So which also somewhat creating some fear among our international community because they're not familiar, because many of them are not familiar with this so-called dynamic zero approach, and they're concerned of the future here. So the administration has a hard time trying to explain to them, try to calm their fear. While meantime, they need to also address to the local community, which care more about public health and want to make sure that the virus would not further spread.
How much is the mainland of support to Hong Kong in this regard, and also in other aspects of fighting the pandemic?
When we're going to be launching this compulsory mandatory testing, one of the key components is also obviously the technicians. Currently the capacity in Hong Kong is very limited. The turnaround time for a test result sometimes longer than 1 week. So it's way too long. I mean, you can't afford to wait 1 week to identify whether you're positive or not. So without the help from the mainland, there's no way we can even carry out this massive testing regime. So my understanding is the Chinese authorities already sending, at our request of Hong Kong government, they can send up to like 9,000 of these supporting technicians to Hong Kong, and also the labs. And clearly, the lab in Hong Kong cannot have such a turnaround time. So we probably have to rely on the labs in probably Shenzhen on the mainland side to help us to turn around the result. I would envisage that the amount of time that we going to sort of restrict people is probably going to just in a few days' time. So you mean testing result also need to be turned around probably within 1 day or 2 days at max, so that we can identify those who are tested positive. So apart from that, of all these isolation facilities, and the mainland side also give a huge support to Hong Kong. The construction company from the mainland coming in, prefab, and so they can help to install these isolation facilities for us. So they've been giving us tremendous support from medical supplies to these quarantine facilities, to testing capability. All those are all coming from the mainland in support to Hong Kong.
But at this moment, I just want to confirm it is the administration in Hong Kong that is establishing, adjusting, and also operating the overall system regarding pandemic prevention and control, right?
Indeed, it is. It's been made very clear. In fact, President Xi Jinping has already make it very clear that the ultimate responsibility lies on Hong Kong government. But of course, Hong Kong government has been requesting support from the mainland, and the mainland side has given us full support at our request. So it's entirely up to Hong Kong to decide what we need here, because Hong Kong is historical histories and all the way how things are being done here are very different from the mainland. So we cannot just simply copy and paste the mainland's methods to Hong Kong. No, we are very rather unique here. But without the support from the mainland, a lot of things can't be done in Hong Kong effectively. So the decisions are here, but the support are coming from the mainland.
Hong Kong experienced a lot, and the current administration has been working hard from its own perspective to handle many issues all at the same time. Tell me more about how do you see, in retrospect, the past few years, briefly?
With the support from central government, we were able to introduce the national security law and electoral reform to put the city back in order, and that itself is already quite a traumatic event. And then follow immediately with that is obviously the pandemic. So I think back to back in the last 3 years, it has been a very trying time for Hong Kong, for not just for the government itself, but also for the Hong Kong people. But I still believe that Hong Kong being such an important part of China, is the most international city of China with one country, two systems. I have no doubt that Hong Kong will able to turn around once the pandemic is being under control and so forth. But at the moment, it has been very trying time. You can imagine, nobody is happy with the administration for also a reason, because their lives has been affected. business has been affected, and family reunion is not possible. For the great majority of Hong Kong people, they have been somewhat being separated from the mainland for the last 2 years because of heavy quarantine requirement to enter the mainland. And that's for the Hong Kong community. And for the international community, they also feel frustrated because they also cannot return to their motherland, as well. So you can imagine everybody has been frustrated over the last 2-3 years. And the burden on the administration is huge. I mean, you can imagine, back-to-back 3 years of, these unprecedented events. And you can imagine, none of the what you have on the playbook ever teach you how to address all these issues. So, and you cannot handle it all alone. I mean, we are very thankful that we have our motherland, mainland behind us. Otherwise, we couldn't have handled all these situations on our own.
That's my exclusive interview with Bernard Chan talking about the latest challenge against COVID-19 in Hong Kong. Bernard Chan is also a deputy of the National People's Congress. The meeting is going to convene later this week in Beijing, and World Insight will be at the Great Hall of the People to bring you all the latest. I'm Tian Wei on behalf of my team. Thanks for being with us. Bye for now.